Hey cheeky chatters. Today we're coming live from my apartment. So there are going to be a few more distractions by the fur babies, but I did set up a cute little learning station here with a whiteboard to really help us talk about pregnancy today. The reason why we're doing pregnancy today is because over the weekend, my friend Kaylee, who's a doula in Wilmington, and I started filming for our birth prep, push prep course. It's going to be online and like study as you go on your own site type of birth prep course. So we spent like a whole half day Saturday filming different laboring positions as well as birth positions and exercises to help get your pelvic floor ready for the big day. And then Sunday, Caitlin with Family Nutrition Solutions and Jody with Fit for Mom and I, we hosted a balloon boot camp at Pelvic Prescription at my clinic, and we had 8 ladies come in who were really proactive in wanting to learn more about how to support their pregnancy through exercise and nutrition, and also how to protect their pelvic floor during birth. So it's on my mind, pregnancy, because all weekend that's what we were talking about. So I figured we would just dive a little bit deeper into it and also talk about it here today because it's one of the topics in our guides. So I'm going to be talking about first the different changes that happen in pregnancy to your body. So one, talk about body changes. Distraction. So we're going to talk about body changes. We're going to talk about different issues and problems that a lot of women face during pregnancy, like pain, leakage, prolapse. So kind of like problems. And then 3, we'll talk about how to address those problems that a lot of women face in pregnancy. And, you know, your doctor or whoever might say that it's normal for you to experience like pain during pregnancy, but it's actually not normal. 50% of women who are pregnant actually don't experience any pain during pregnancy. So, you know, what's the difference? Why is it 50%? So we'll talk about that too. Okay, so major body changes during pregnancy. The first one is, we'll start with like more of a cardiopulmonary point of view. So even as early as first trimester, within the first like 4 to 6 weeks of being pregnant, sometimes even before, you know, moms even realize that they're pregnant, you'll start to notice a little bit more out of breath, a little bit more tired easily. That's where you get a lot of the first trimester like nausea or fatigue. And that's because your body is going through a lot of changes. And one of them is your cardiac output, which just means that your blood, your heart is pumping more blood volume throughout your body as early as those first few weeks. Also, you'll notice like being more out of breath and everything. And so your body also increases its demand of oxygen, again, as early as 4 to 6 weeks being pregnant, which is wild. So that's some of the cardiopulmonary changes. Now, what I'm going to really spend some time on are the postural changes and the increased demand on your pelvic floor, because that's what can lead to a lot of injuries during birth or even postpartum. So postural, you'll notice that throughout pregnancy, moms, like their spines will sort of change shapes. So normally your spine will sort of, you know, you have a little bit of a curve here at the neck, a little bit curved this way, and then a curve that way. So this is like your head, and then this is your neck here, upper back, and then you got your low back here. Now during pregnancy, what changes is you'll notice that your low back starts to arch more. And so we usually say that's like an anterior pelvic tilt. And so you'll see the low back start to move more forward, and the center of gravity during pregnancy just keeps on moving more forward, and that can really throw off like your balance. It can, cause like back pain. You start to walk a little different, which can cause a lot of muscle imbalances too, which can eventually lead to injury. And then for your upper back, you'll see as your breasts get bigger, you're going to start to get that like forward curve here, and sort of like your neck this way. So you'll start to see those changes. So a little bit more forward, a little bit more of like an arch. And the reason why we're talking about that is because not only can that cause a lot of like neck, shoulder pain, but also like low back and hip pain. And those are like really common things that, a lot of people will just sort of like write off as like normal. But really it's not normal, and there is a lot of, there's a lot that you can do preventatively to prevent it from getting worse. So that's some postural changes. You can also experience some like nerve compression. So a lot of moms will complain of like sciatica, or even some like upper arm like nerve pain, and that's just usually from the postural changes as well as muscle tension. So during pregnancy, your muscles will just get really tight because they're just trying to stabilize your pelvis as everything is moving and growing, and that can cause a lot of nerve issues as well. And then the other thing I want to talk about is like pressure changes. And so this is where some like pelvic floor issues like prolapse and leakage can really become a problem. And even diastasis, aka ab separation in the center. So if you think about your torso as like a balloon, I did this in the last video, so if you imagine this is all a ball here, my core. If my back starts to arch and my head starts to round, all of a sudden I'm not in good alignment anymore. And when I'm not in good alignment, pressure gets off. And when that pressure isn't evenly distributed in your core, more pressure is usually directed downward towards your pelvic floor, and your pelvic floor is working literally overtime during pregnancy. It is like your MVP. I mean, even when you're not pregnant, it's an MVP, but during pregnancy, it's even like more so. And so when your pelvic floor when the demand on it is like really high, like it needs you to be performing like up here in order to support you, to make sure that you don't pee your pants when you sneeze, to make sure that you can go on your daily walk without having pain, to make sure that you don't feel like vaginal pressure or something falling out of the vaginal canal when you're walking or lifting. If you have a toddler and you're pregnant, then you're having to probably do a lot more lifting than maybe what you did during your first pregnancy. And so that pressure can lead to a risk of prolapse if you're not bracing and learning how to use your pelvic floor correctly. And the reason why you gotta learn that is because postpartum, your body has been through so much, and so everything that you do during pregnancy is preparing you for that marathon of birth and also postpartum. So yeah, those are the changes that we usually see: postural, increased demand on your pelvic floor, on your glutes, and some cardiopulmonary changes as well. In terms of pelvic floor, so we're going to get a little bit more specific about what your pelvic floor has got to be able to do to be able to birth. Let me erase the board real quick. So your pelvic floor, in order to have the best pelvic floor health that you can have during pregnancy and postpartum, your pelvic floor has to be able to function like a trampoline. So if you think about a trampoline, that would be the trampoline at just like a baseline. Now the trampoline, it can move up. So it can move up, or the trampoline can go down. So we can either go below this point or above this point. And I love that analogy because your pelvic floor is not a static thing. It is flexible and it has mobility. So, or it should. Not everybody's does. So what, if you're watching this video right now, what I want you to try to do is put your hand on your booty hole. And while you're holding there, I want you to think about squeezing in like you're trying to stop a fart from coming out. And so what you should feel, so if this is my hand, this is the booty, your hand is here. When you squeeze, you should feel it actually move away from your hand. And that means you're doing a Kegel correctly. And that's the trampoline moving from here to here. Now, hand on booty hole again. Now try to bulge or push out. And when you try to do that, you should feel your pelvic floor pushing against your hand. And that is your pelvic floor going from here to here. So having that full range of motion of your pelvic floor is essential in pelvic floor health and making sure that your body is ready for birth and also ready for recovering postpartum too. Now, I always hear a lot of people say, I want to come into pelvic floor therapy because I need to strengthen my muscles. And then they come in for an evaluation, and then we find out that actually their pelvic floor is already really tight and up here. It's like stuck in this phase versus being able to move. It's just stuck here. And the biggest concern with that in pregnancy, and side note, in pregnancy, the reason why it's really common to see women with a more tense pelvic floor is because of all the pelvis changes. Your muscles are just overworking to try to support you. And sometimes when they get overworked, they get really spasmed and tense. And sometimes you don't know that it's that way. So a pelvic floor assessment will give you the answer to that. And the reason why we want this pelvic floor to be flexible is because during birth, the muscles actually have to open. Think about it like this. Like if I were the baby and these are the pelvic floor muscles, they have to open in order for the baby to exit the birth canal. When your muscles are tight, then baby has a harder time exiting the vaginal canal. So that's why I love giving that example, because it can really shed light on why it's important to do pelvic PT prenatally, to learn how to control those muscles and learn if your muscles are doing the right thing for you, so that it can make your birth experience a lot like reduce active labor time, reduce the risk of like perineal tearing, or the risk of having to use like a instrument assisted delivery like forceps or a vacuum. And so those are all different, like really important reasons why it improves the birth experience, as learning how to lengthen your pelvic floor muscles. And before we touched on the other reason why it's good to make sure your pelvic floor is in good health is because you want it to be strong and flexible to prevent injuries or issues like leakage and hip and back pain, and prolapse and diastasis, ab separation. And then I already mentioned this too, but also improving your postpartum recovery. So, that's why your pelvic floor matters, is because it plays a huge role in not only your actual birth experience over here, but also your postpartum experience over here. I'll hear patients say like, oh, like why didn't I know about this sooner? I wish I had done this for my other pregnancy. I wish I, had known before. And there's no problem with that. It's just, nowadays there's more and more coming out of how beneficial it's actually to do before postpartum, and it's more to it than just that. To sort of wrap up this little pregnancy talk, I want to talk about a couple of myths that I hear. One we covered, it's that, actually two we covered. One is that like pelvic PT is only helpful for when you're postpartum. I would argue that it's just as important, if not more important, prenatally to get your baseline and prepare for that marathon. The second one is pain during pregnancy is normal. Again, I give that 50% stat about how that's actually not true. While pain might be common, it's definitely not normal in pregnancy. And the other one is around um, diastasis, so avoiding ab exercises during pregnancy. Um, at one time, it was thought to avoid it because there was fear around making it worse. But now we know that avoiding all ab exercises during pregnancy, that can actually contribute more to diastasis than we originally thought. And all women in pregnancy will experience some ab separation just because as your baby's growing, it's natural for the muscles to actually spread apart to create more room. It's more so what happens postpartum that could lead to be a problem with ab separation or diastasis. So yeah, that's a little bit about pregnancy. So we covered body changes that happen that could put you at a higher risk of an injury either during pregnancy or postpartum. And injuries include back pain, hip pain, any kind of pelvic pain like pubic bone pain, which is lightning crotch, tailbone pain, SI joint pain, uh, pain with intercourse. That's also not normal to experience and could be a sign of your pelvic floor overworking, which can lead to issues during labor, as well as bladder issues like leakage or constipation, prolapse, and more significant ab separation. So yeah, those are body changes. Those are some problems that you might see but are totally preventable and treatable. And then the solutions. So I'll end with this. When it comes to solutions and trying to address these problems that come up in pregnancy, or when it comes to being proactive, we really break it down into three steps to make it just make sense, basically. So the number one thing that I see with these like pain kind of problems is a lot of weakness. So the first step one is really getting stability in the muscles outside your pelvis. So step one is to really strengthen those muscles. One caveat to that would be if you're coming in during pregnancy and you're already having some symptoms and problems like pain, we might do like there might be some component of like stretching or hands-on therapy to really do some soft tissue work to the muscle that might be causing some symptoms. But it's definitely not like a long-term solution. So one is strengthen the muscles outside the pelvis as well as your core too, because that's going to support you during pregnancy and get you strong so that when that marathon does come, you're totally ready for it. Step two is lengthening, and we usually start this around 20 to 25 weeks. It kind of depends on how your pelvic floor assessment goes. Like if your pelvic floor has a lot of tension, then it's probably something that we have to work on sooner rather than later. But if you don't have a ton of tension, then focusing a little bit more on strength and stability is a little bit more helpful for you. So it's kind of an individual thing. But step two is like flexibility. So you got that strength of the trampoline, you got that flexibility of the trampoline. And that looks like, let's see, that would look like pelvic floor stretches, learning how to do perineal massage, which we teach, and also some manual therapy for like hands-on work inside the pelvis as well as outside the pelvis. Now, step three is really like getting into labor and birth prep. So I know a lot of people will do like birth classes and stuff. There's a lot of awesome birth classes that doulas put on and one-on-one birth ed where you can learn a lot about the birth process. In terms of when it comes to doing birth prep with like a pelvic PT, it's a little bit different because our focus is on the pelvic floor and protecting your body and being preventative in any issues or problems that or like injuries. So what we'll do is like we'll usually assess your pelvic floor to see which birth position your pelvic floor responds the best in, because it's different for everybody. It's a very individualized thing. So getting you in each position, seeing what your pelvic floor is doing, even practicing how to push. So like earlier when I said about the bulge, you have to learn how to bulge your pelvic floor, learn how to let it lengthen, because that is the movement that will help allow your pelvic floor to get out of the way so that your baby can exit the birth canal. And usually we cover a little postpartum stuff there too, but that's not for this video, that's for another video. But yeah, that's a little bit about birth and pregnancy changes and what you can do about it. The number one takeaway that I would make sure that you are taking away from this video is, one, Kegels are not the answer, and they're not enough to be the only thing that will help you prep for birth. If anything, it could make things worse. And then number two, we didn't really touch on this, so I'm glad I'm taking a moment to talk about it, but it's how important, if you are able to be active during your pregnancy, it is so, so essential to be active. Even if it's a little walk, even if it's just some like body weight exercises, like being strong during your pregnancy is the number one thing that you can do to get your body ready and prevent a lot of pregnancy and postpartum related issues. And pelvic PT is always there to support and help you get to your goals as well. Okay, that is all. We'll be back next week for another cheeky chat where we will dive a little deeper into the early postpartum, like the first 6 weeks of postpartum, talk about that. So thank you guys for watching.